everyone, it's Dr. Russell. So today I'm going to talk about the surprising effects of estrogen. So I think we all understand that estrogen has some part in the role of our periods. Maybe we don't understand fully what that is, but that's okay. But what we don't always think about is all the other effects in our body that estrogen has. It's not just related to cycles. So to start, let's make sure we understand the different kinds of estrogen first, because there are actually three different main kinds. So the first one, the one that when we're talking about estrogen, we're actually mostly talking about this type of estrogen. It's called estradiol. E2 is the abbreviated term for that. And estradiol is the strongest estrogen. It's the one that's given when we give kind of estrogen to supplement for women. It is the one that is most associated with women in the reproductive years. And because it's the strongest, that's why it's the most researched. We don't care so much about the weaker ones just because they don't have as strong of effects. But the other two estrogens is estrone, so that's E1. So estrone is more commonly associated with menopause, and it is weaker, so it doesn't have quite the same oomph as estradiol does. So that's why menopause we tend to notice changes in our body related to the decline of the stronger estradiol. The third type of estrogen is E2, and that's estriol. And estriol is only present in pregnancy, and it is the weakest of the estrogens, so we don't really study it probably as much as we should, but really most of the things that I talk about today are related to estradiol, and again, in any studies you see, it's probably estradiol that they're studying. So now that we understand the different types of estrogens, let's talk about first periods. So estrogen obviously affects your period, so estradiol is going to help your uterine lining grow back. It's going to be more prevalent during the first half of your cycle, so after your period ends until ovulation. It's still going to be present though in the second half of your cycle. After ovulation, it just isn't going to be as high as it was in the beginning. So that's the main thing with estrogen or estradiol in the cycle, is that it helps kind of replace the tissue that was lost during your period. But as far as the other effects of estrogen, again, specifically estradiol, is pretty much body-wide. So it affects bones, it increases bone health and bone density, which is really important. It also affects skin and collagen production, as well as kind of the thickness of the skin. And you'll note as I go through these things that a lot of these changes, or kind of the negative effects, if we didn't have it, are very commonly symptoms we see in menopause. So for bone health, that tends to decline after menopause. Same with skin, kind of lose collagen in our skin. So you can see how important the estrogen and estradiol is to our overall body health. The other thing that there needs to be more research on, but it's really intriguing, is the effect of estrogen on appetite control and behavior. So it definitely seems to be very gender biased in that. And again, we need more research, but it might affect things like addiction and appetite and all kinds of stuff that we really haven't fully delved into yet. But it's really, really fascinating. The other important thing is estrogen does affect brain. So it affects working memory, cognition, speech patterns, development, learning. So again, that's why when you go through menopause, usually memory kind of goes and you might have trouble with those things. Or maybe you notice that even in your cycle throughout the changes. Maybe you're not as eloquent or have trouble recalling words, and that might be related to your hormone changes throughout the month. So that's another important role that estrogen plays. And there's actually some research going on in relationship to Parkinson's and Alzheimer's and other brain conditions, looking at estrogen as possibly a therapeutic thing to introduce to benefit that, just because of the positive effects it has on the brain. So that's kind of amazing. The other important thing that estrogen or estradiol does is it helps sensitize insulin. So insulin is really important for getting your blood sugar to be stable, but if it's resistant, that's where we get things like diabetes. So having nice sensitive insulin is a good thing. So estrogen actually helps with that, which is kind of amazing. Estrogen also helps keep cholesterol at really stable levels. So that is another thing we tend to notice. Once menopause hits, cholesterol can be changed. Again, there needs to be more research into why exactly, but that is something that we do commonly see as a pattern for women. And then the last thing, again, I could go on for days about this, but estrogen is very similar to a hormone called aldosterone, which helps to retain salt. So women, if they find that they are more what we call estrogen dominant, they might be more tending toward things like bloating and weight gain, like water weight gain, just because of that estrogen imbalance, because it looks similar to a hormone, aldosterone, that retains salt and therefore retains water. So hopefully that was interesting. I think it's fascinating. Again, estrogen, as we kind of went through, body-wide effects on everything, which is kind of amazing. Please let me know if you have any questions. Bye.